So let's see what kind of equipment we need for positioning and draping. As you can see there, lots of pillows or a support system is beneficial, but let's also talk about the table itself. So you're going to tend to need your table at a higher station than you do normally for deep tissue. When you're pressing down on somebody's back in a prone position, generally you want the table to be low so that when you're standing, your knuckles rest on top of the table. When you're working sideline, you're going to need a table a little bit higher than that. So you want an adjustable height. And the width of the table also matters. So some tables are 27 inches in width and most come 30 inches. You definitely want to have 30 inches wide or more with all the extra pillows, and a lady with the baby in her belly is going to have a larger need. So definitely a wider width. The foam padding that's on top, most of the reputable brands have about 3 inches of dense foam padding underneath their vinyl or whatever material that is, the massage cover. So some of the chain things like are sold in big stores that aren't really professional massage tables might not have a foam padding. So I don't know if you do house calls and people have their own massage table there or something like that, you would definitely want to have an extra table cover with some padding on that. So you want at least 3 inches and then maybe an additional, what do you call those things? The fleece table pad cover or something like that. Speaking of the fleece table pad cover, you probably would like to get a covering to go over top of that for pregnant and postpartum women, because they tend to have a little bit of leakage here and there, especially postpartum when women are starting to breastfeed. They might have milk. A lot of women will wear their nursing bras with pads in there, or you can lay down some extra towels underneath the sheet so the terry cloth isn't abrasive against their breasts. So maybe some extra towels as well. And then if you have a hydraulic table, that's great to go up and down. Hydraulic tables also, you want the ability to recline the table. Or if you have a regular manual table, portable table, one that would have an adjustable tilt feature would be very beneficial, so you can add a semi-reclined or reclined position with pregnancy. That a standard table, it's kind of hard to set up with pillows and get somebody comfortable, and don't really recommend trying to do that. Either get the tilt table, it's usually the same price as a regular table if you're going to be doing a lot of pregnant women, otherwise going from side to side. Other equipment that you might need for maternity massage would be a sturdy, wide step stool, because when you reach over that reclined table that's been tilted, if you're short, you might need an extra step stool for yourself to be able to get into the neck and shoulders. Or if your table's up higher than normal and you're tall anyway, it might be hard for the pregnant woman to get up onto your table because it's higher than normal. So a nice wide step stool that's not going to tip over would be great. Then some small pillows like airline pillows or small wedges for abdominal support for the baby. Then either the body cushion support system, or you'll want to have 6 to 8 pillows of a variety of sizes and density. I usually will use 3 to 4 king size pillows and a standard size pillow, but you can do any combination. You'll see when I show. So you usually use a twin-sized sheet for draping, and maybe use 2 flat sheets. Well, on this one, we might want to use a fitted sheet on your table so it doesn't slip when they're turning from side to side. And you might want a full-size sheet for your top drape so that you have a little extra sheet to go around a larger person. And then some pillowcases or large towels for breast drapes. And then, if you don't already have unscented lotion or oil that you use, we want to make sure that you have something that doesn't have any additives in it. For pregnancy, a lot of them might have some sort of essential oil added to the massage lotion. So you want to make sure that there's no aromatherapy during pregnancy. And you can always add it in if you want, but that would be something to get. And then other things, maybe a foam wedge that you could use to prop the legs up when they're reclined, or if you don't want to use pillows, or some reference materials that you can use to share, like we went over in the pregnancy lecture, the books or articles, or maybe even charts for educational purposes. So I think that's about all the equipment. And then we will go over some setup variations and how to use pillows, how to use body cushion support systems, how to keep the spine in line, how to keep the hip, the knee, and the ankle level to avoid strain on the bursa and the SI joints and fascia going across the low back and the hips, options for the shoulder and avoiding pain in the shoulders, bursa, or any impingement syndrome. So I'm going to show you a bunch of different ways to set up for positioning for pregnancy and pros and cons of each, and you can decide for yourself. So this is a typical body cushion. So this was the first thing that I had in the old days, and it was meant like first trimester you could go like this. It's got a cutout for the belly in here for the baby and little breast holes in here. And then it came with a variety of different wedges and things like that so that you could prop it up for as the baby grew. And now they came up with this elevator thing. And it basically raises it up so you don't have to mess with putting a little wedge on each side of the cushion and teeter-tottering and all that kind of stuff. So it just goes right on top of the massage table, and then this goes on top of that. And then there's, I don't know if you want to come and look, and then the hole, because it's like a black blanket, but you can see like the hole down here goes deeper, and then the pressure comes off. So some of the pros and cons with this. With this, it's kind of cool that you can move the head back and forth. It's Velcro here, so I can adjust it and make it a little longer so I can. So if I wanted to move their head side to side as they work on their neck, I can do that. And it's nice for fetal alignment, so optimal fetal positioning as the baby can turn and be occiput anterior. But it's really just for, in my opinion, for Swedish light massage, relaxation type massage, not for deep tissue. The other thing is when they're actually laying over this, it's pretty high now if you get a body on top of that too. So if you don't have a table that's adjusted and you don't have pregnant women all day long, you would have to unscrew each leg and then shorten your table and then put it back up for the next person, or is back and forth, and or hurt your own back. Not as big of a deal with Swedish because you're not doing deep tissue, so you don't need the extra weight of your body to compress down, which would hurt you. But you know, it's also not a one size fits all. So somebody who's very large breasted might not fit in these holes, or the little foam pieces might poke into the side of their breast or underneath it. You might have an extremely short person like me
who your hip should end down here, and maybe that's down by your knees now. It doesn't fit you, and so you might have to add more pillows and things like that. So if you don't do the prone position, I don't, you can still use the cushion in different ways for sideline. So if we eliminate the headrest here, take that off, and if we eliminate the elevator from underneath, that's and then we use this hole here, and you can probably come up so you can see a little bit better. This then can turn to a sideline position, and this I actually use for people who have bursitis in their shoulder, or people who are maybe high risk and they just lay on their left side all day long in bed rest, and their left hip and their left shoulder are so sore, but they're supposed to just lay on that way. I'm just going to hop up on here and show you that what was for the stomach can now be for the rib cage, and your shoulder can go through the hole, and you can lay your head down here and there's no pressure on your shoulder, and this can be really supportive and comfortable. So the con is, if you're using this and you're going from side to side, once they're laying on here, and this is going to be covered up with sheets and everything, when they're turning to the other side, now it's in the wrong position. So you just kind of somehow get it over to there, which means that they basically have to completely sit up, put the sheet around them, make sure it doesn't fall off in front of them. It's hard to sit up straight with the baby in the way, and then move it over and then cover it back up and get them back into position, and it takes a lot of time and it's kind of uncomfortable. So that's kind of the problem with this. It's kind of a one side for me, or you keep it in the center of the table, and then you're hurting yourself as you're reaching to reach for the thing, and you're having bad body mechanics, but they're comfortable and don't have to.
Okay, there we are, sideline time. So I just wanted to show like the neck here, how it's in line with the body, and the edge here of the body cushion actually takes up, here's the edge of the table, and then when the body cushion's right on the edge of the table, you still have all this, so there's still that far away from the edge. Maybe I can get the whole table in here, you can see. So even when you put it to the edge, if it's centered, if the body cushion was centered in the table, then you'd really have far to reach for doing deep tissue. So this is like as close to the edge without having the body cushion go over, and then with the body in the center of the groove where the stomach hole is for a pregnant woman is where the rib cage now is, and the head lays there. And then you can back here, sometimes people have different size necks, and you might need an extra pillow on top of there yet. If their width between their shoulders is wider, then their neck might have a little gap between that and the body cushion. You need an extra pillow. So then we want to come in and see, are they rotating forward or are their hips stacked? So she's kind of rotated forward a little bit.
Okay.
Yeah, thanks for doing that so we can explain. And now you can see the knee is lower than there. So I'm going to go grab another pillow, but the arm looks good, everything's good. We just need to get that knee a little bit higher because we've got the ankle high, the knee low, and it might just be a little bit of an adjustment and we'll be good. So there's a couple things that have to happen. I have to move all the pillows, so that'll be step one. Then I have to somehow get this cushion to that side of the table without exposing you. So I have to keep you draped while you sit up a little bit. And then what tends to happen is this part's easy to move, and this part they'll be like sitting on a little bit with their hip, so it doesn't want to move, and you gotta kind of like yank it or use the sheet to move it.
Yeah.
So I'll just show you how I do it. So I'll tell them I'm just going to take all of the pillows out first, and I'll usually take them out the way I put them in. So usually I do the legs first and do the upper body second.
Okay.
So I'm going to hold all three pillows at once, and I can support your leg as I do it, or I'll tell them to guard their leg so it doesn't go flat.
Guard their leg. Okay.
It doesn't.
Oh, yeah.
Get all of these out.
And then just gonna make sure that the part I tucked under your butt's out. I'm gonna get this pillow.
Okay.
Hang on. Sometimes it'll start turning before you're ready, right?
Yeah, it's middle time. Alright, okay.
So what I'm gonna do, instead of like holding the sheet and having you turn over, is I'm gonna hold this part of the sheet,
Okay.
and then your arm's gonna come out there.
Okay.
I'm gonna hold this sheet, and I'm gonna have you just sit up. You can use your arm to push up if you want, but I'm gonna
Okay.
keep you covered. So just, and I'll use my fist to kind of support you here.
Oh.
Yeah.
Okay. I get it.
And then,
you just move it.
right, so, are you okay?
Yeah.
Yeah, so I touch in and make sure that they can breathe and everything. And I'll do like, you know, when you wrap a towel around you,
Yeah.
I just kind of do one of those things.
Okay.
That gives me a little bit more time, because this isn't too hard to sit like this, right?
No.
Straight, and I might even just hold that with one hand, but really, it depends how tight that is. I might be able to let go of it, but because there's a camera on you, I'm not going to. And then I take the little handle of the cushion,
Okay.
and I'm sliding the body cushion over to the edge of the table,
Okay.
and making sure there's a space for the arm.
Okay.
And then I'm going to cover it back up with the sheet, make a little arm pull here. And now, I gotta unfold the back, and hold it here.
Okay.
And now you should be able to just
You
turn
just
that.
yeah.
Get your arm in there.
Oh, yeah. Okay.
And so the cushion just went with you a little bit as your hip came up. So I can kind of scoot this up a little bit.
Okay.
How does that feel?
Yeah.
That was pretty easy. Not
Yeah.
as bad as we thought.
No. No, that was easy.
Okay, and then just untuck it.
Okay.
So it works. And then I'm going to have you straighten both of your legs. I have a place to put the pillows.
Okay.
If you only have one pillow, you could just put a pillow between the knees. You know, it's not the end of the world or anything, that's fine. The pillows are soft enough. It'd be different if you had like a foam cushion that you're putting between that would put pressure on the inner thighs where the blood clots are. But sometimes people feel more comfortable with just a pillow between the legs. Or if I know I'm gonna do a lot of that, moving your legs up and down and that, I might not wanna deal with 3 pillows and I'll just put a pillow between the legs.
Okay.
But most people feel like a little bit more comfortable. Like if somebody has trochanteric bursitis and their hip hurts, like their hips are killing them, I'll do it this way for sure. Because if your leg is straight on the bottom, it doesn't put pressure on there. As soon as you bend your knee, it like sticks out and digs in the table and it hurts worse.
Yeah.
So some people would even like want a pillow under their hip, and then like how are you gonna get that under there once they're already on the table, and it's hard. So then I'll get the sheet up and have you lift your leg, and I just guide it,
Okay.
and make sure you cover whatever adjustments I need to do. Your hip, your knee, your ankle, all looks good. Sometimes I'll ask, because like pregnant women's hands and feet are really hot, I'll be like, do you want your foot uncovered?
Yeah.
Or do you want it covered? Like, you know, because sometimes
Yeah.
people want their feet uncovered.
Some people get hot.
Yeah, so sometimes I'll just like leave it like that. And you want yours covered though?
Oh yeah.
You want yours
Yeah,
covered. Okay.
I'm a covered.
Okay. And then same thing with this pillow. Like I could just put it like this and have your arm on the outside. And I'll usually just do that because if their arm is cold, then I'll take like a hot towel, and then it actually just feels really good to like, you know, compress them. This isn't hot, but if it was, it feels like really good and nurturing and all that. And I might do some like, you know, like upper trap compressions and all that kind of stuff, like while that towel's on there, and that feels good. And it can come around. Okay, so now I got a bunch of pillows with random colored pillowcases, so forgive me for that. But we can recreate that shoulder space if we wanted to with pillows, or we don't need to. But so I'd have one for the head, usually a little bit bigger. And when we have somebody lying on the table, I'll tell them when they lay down on their side that they want to make sure that their shoulder isn't on the pillow and compressing it, otherwise their head's going to be tipped to the side. So when they get down, they should get their shoulder on first and then kind of move the pillow out and put it in here. This pillow, if you have it in here, pros and cons. So pro, no pressure on the shoulder, does the same thing as the body cushion. It also supports the low back, so if somebody has big hips and little waist usually, this pillow will help support that little gap, but not as important when someone's pregnant. That kind of goes away, and especially in my case, I kind of look like a pregnant goat. So sometimes this can actually push the spine the incorrect way, having this here. So it helps the shoulder, but it hurts the spine. So I don't usually use this in late pregnancy when they're really big all the way around, unless they're just really front heavy and there's nothing on the side and they need that support. So it's got to be individualized for that person. So this is a maybe here, but this is a must. Then we want a pillow here for their arm to go on, and I usually put it on the side rather than flat. So there's more room on the table for one, but two, their arm will lay on top of it rather than over it. So we want to keep their shoulders in line and stacked rather than having their shoulders medially rotated and compressed like they are all day. So this keeps their shoulders straight and makes their spine straight and not collapsed forward on the table. So the shoulders and the hips should both be one through one end and out the other. Like if it was a skewer, I'd go through one side and come out the other. That's maybe not a good example. Anyway, but they should be stacked, not collapsed forward and not collapsed back. Like sometimes they want to see what you're doing and they're looking back at you and then their body's all twisted. So you might want to start off on the other side. There's a lot of different ways to do it. Then we'll have pillows here. So you could put one pillow between the legs like they do a lot of times at home. But that actually makes the greater trochanter stick out, put more pressure on there, and it just works really well. There's no pressure on the inner thigh. If one leg is straight, so I'll have their whole body in a straight line, and just their top leg on top of the pillows. And then how many pillows you put here is gonna depend on how big their hips are. So what we don't want is for just one pillow down there, because then their hip's gonna be here and their knee's gonna be way down here. And then the weight of the leg is gonna pull all those muscles of the hip down, and it's gonna be doing that same thing in the SI joint. It's gonna be pulling those ligaments and straining. Sometimes it feels good though, if they're really external hip rotation, it sometimes feels good to stretch it the other way, but most of the times it doesn't feel good, and you need to put, so maybe I need to put 2, maybe I need 3. Maybe I work at a location that only has one pillow, and then I'm going to put it between their knees because I want their hips, their knee and their ankle should both be up here. If the knee's down, it pulls across the hip. And if the ankle's hanging down, the knee's at the right height, but the ankle's turned down, then you're gonna get the piriformis pulling. So unless you wanna stretch it, then that might feel good, but most of the time, this is how you're gonna set it up, like this. And you'll tell them to get in there and they're gonna be like this, right? Everything else is straight and they'll be as close to this edge of the table as possible. Sometimes when people lay down on their side, they get into a fetal position, and then their shoulders are way over there and their butt's way over here, and you'll tell them to move back and they just move their butt even further and they're in the same position. So sometimes it helps to just put your arms at the edge of the table and say, scoot back till you feel the back of my arms, and then their butt will hit you. And then it'll be like, okay, now your shoulders too. Keep your butt in place and keep moving your shoulders till you feel me. And you take a little extra time the first time explaining how to do all this stuff, but when they keep coming back to you in subsequent sessions, you don't have to keep explaining it. They already know how to do it. So the other real trick for setting up, take this off for a minute, is what to do with the sheet to prepare for draping when you're on. So I usually start people off on their left side, and I usually teach that way too because it's easier for a right-handed person to learn on a person's right side of their body, because most of the work you're going to do is with your right hand. And some of these techniques are going to be a little bit harder when we turn them over onto the other side, because then most of the techniques are going to be done with your left hand. So if you're left-handed, you might want to start them off the other way. But the reason I start the pregnant woman on their left side is because they're used to laying on their left side so much that that's the side that hurts. So I'd rather start off laying on that side and then turn them over and work on it second, so that feels better, not make it feel better, and then they turn over and lay on it again, and it just negated everything I just did. So usually when we're making up tables, like I know massage therapists, and they always want to have the crease of the fold from your laundry going right down that center. It's got to be perfect. Don't you love when somebody helps you make up your table afterward and they're trying to be helpful and it's like crooked, and it's like, you don't have to be OCD for that to drive you crazy. So, but this is the rare incident. So your bottom sheet will be the same, but the top one, we're gonna have it a little bit longer on the anterior side of the body, and the posterior side will be a little shorter. So we're gonna pick it up and move it over, so it's a lot longer on this side, and you just have a couple inches over on the back side, just enough so that when they get in there, their butt's gonna be covered and not poking out and back. And so then I'll just follow it down and make it even. So this is the behind the scenes stuff here, right? So then we get it longer here. So when they get it on and we eventually drape them, they're gonna have more in front. So when you're learning this and you're doing it for the first time, if you accidentally would expose somebody, it'd be much better to do it behind than in front, right? So at least that's all covered for one. But also we're gonna have all the pillows over there, so when they get on and the pillows are there, it'll be kind of even. And when we go to drape and expose the hip and the leg, there'll be sheet to drape. If it's even, we'll run out of sheet and be like, oh, that doesn't reach and we can't do our origami. So I usually get this all in place first, and then I'll put the pillows on, or I can put the bottom sheet on, place all the pillows, and then put the sheet over the top, either way. But if you already have it made up and you didn't know they were pregnant and they show up with a big, large tummy, then all of a sudden we gotta get our table ready in a hurry. So this is how you do it. You just kind of move everything over, and then we're gonna, oops, not trip on our cord. We're gonna put pillows in here. So I'm gonna put all these back. And I'll size up my client and say, how many pillows do I need? And I think 2. I'm gonna say 2. I'm gonna put those here. And then once I have these on, I can wedge my pillow in between, scoot these up so it stays on end, or you can give that to them later and put it over the sheet. So I'll show you why later, so I can just cover it all back up. Or you can leave it exposed and explain what the pillows are for while it's exposed, and then put the top sheet on. Otherwise they come in and they think, oh, is there somebody on the table already? Looks like it. All right. But usually, so then we'll have our pregnant mama come up. You can leave your clothes on. Shoes off is good. And I'll explain to her like she didn't hear all that. And I'll say, okay, I want your head here, your shoulder here, not on the pillow. And your back along here, your legs straight. And then you're just gonna have your right arm up on here, so it's like that. The bottom arm can be under the pillow, it can be over the pillow, usually you're like that. And then your knee and your ankle up here. And so you're just like that. Make sense? Okay, so then we're gonna leave the room, but we're not really, we're gonna see what happens. And then you kind of get what you get. And I'll say, that's what I'd like you to do. Don't worry, it doesn't have to be perfect. We'll straighten you out when I come back. But in a perfect world, that's what we would like to see. And now we get to see what they actually do. And see, so she's already like, wait, what am I supposed to do with my arm here? Remember, so you're gonna put your head on the pillow. And I would just, so say she's like, ready, and I come back in and I'm like, no, I never do that. But so I would be like, okay, let's fix this a little bit. So I'm gonna have you just lift up a little bit for a sec. Okay, now lay back down. And now I'm gonna put the pillow here. Yeah, that better? And then this, it can either go under, so it depends, like, is your air conditioning blowing, is it freezing? Are they really hot? Pregnant women are hot a lot, and they're like, oh my God, I'm dying. So, like, maybe they want their arm on the outside. And so we could just say, okay, I'm going to, of course she'd be more draped if she didn't have a shirt on, so say I could put it on the outside and the pillow like this. So now her arm's on the outside, but that pillow's also pushing the sheet against her, so it helps keep the sheet against her breasts so they don't get exposed. And if I wanted to do this anyway and her arm was cold, I could always take like a towel or an extra blanket and cover her arm up to keep it warm. Then I want to come here, next thing, and make sure that like her hips are even. So like right now you can see how she's kind of rotated a little bit towards me. And you know, if she's comfortable, that's fine. Depends what kind of work I'm doing. If she's been to me before, if she's used to getting structural work, deep tissue massage, that kind of stuff. If she's been to me before she got pregnant and she's used to me working on her, I might just kind of like manhandle her a little bit and be like, okay, you see how that's like on your side, and you know, maybe that's not the best word, but you know what I mean. Where I might have her roll back to sense where her hips are and all that kind of stuff so that she's even. And we want to see the height of the hip and the knee and the ankle, and see like how far down is the knee than the hip. This is pretty good. I probably just leave it the way it is. If it was dipped way down, I might need to get another pillow. So I might scoot the sheet up just so a little bit of her legs showing and I can see where the other pillows are. I grab one extra pillow. I put edge of the pillow to edge of the pillow, and I use my forearms and I kind of compress the pillow down. She'll automatically lift her leg up and I catch it, and then I can just pop it down and place it back on. So now her knee is a little bit higher than her hip, but that's better, but a little too high than a little too low, because then all these muscles aren't pulling. And usually if they're pillows and they're not like the foam pillows, they'll compress after a while. So after a while it starts coming down and it will be at the same level as her hip. All right. So if I have a blanket, I can just flip it up so I can see what I'm doing. The sheet here, a little tip, so you have something to work with, is to give it a little tug this direction first. And then I'm going to have her roll forward a little bit with your hips, and then roll back and sneak my hand out. That tucked it, and I don't have to push my hand under and pinch her skin and all that. And then we have that point holding the sheet, and I can flip it up and that'll expose her back. She's already got the pillow against there. If not, it's stuck in her armpit, so that's not going to go anywhere. Her hips holding that there. And then we just have this extra sheet area here. Tip here, if you roll it under, over and over and over like that, it will stay in place. You can take your extra blanket for a little extra weight to keep it there. When I learned, we just tucked it in the underwear, and now I guess we're not supposed to touch underwear in any case. So, but if you feel comfortable, that would be one thing. Like she's wearing underwear, I can just tuck it right in there. Some people don't wear underwear, and then that's not an option. But what doesn't work is if you go overhand and you roll it this way, it's just going to unravel, and so then it'll just keep falling down over your hands. And so another thing is, like, you can't massage if you can't see your hands. Well, you know what you're doing and where those bony structures are and everything like that, you'll be fine. But anyway, if you don't pull the sheet up here first and it's down here, and you tuck it, and so I roll forward, place, roll back, sneak out before they hit your hand. It's in tucked there, but now when I go to expose, it's like we miss this whole area. So just by pulling it up, and then I'll just do it the old way, tuck, just push into the table if you're gonna tuck it so you don't pinch their skin. And then now it's like a straight 90-degree angle here. I learned that in math class. All right, so we want to make sure that it's tucked under their armpit or the pillow is against their chest so that we don't get any of the side breast exposed there. If her arm was covered, say the pillow wasn't here, and she was underneath with her pillow, let's try that. And I wanted to get her arm out. Would I reach like this for her arm? No, that would be kind of creepy. So I just say like, can I see your right hand for a second? I'm gonna take your arm out and then I can help her and then tuck it and then place her arm over the top. So that's how we get the arm out. That's usually step one, but her arm was already out when we started. So then we would go about that. So that's the back end that way. And then, so we can kind of get the gluteus, medius minimus area here, even TFL and all that. But now we want to get a little bit into those other muscles all around the greater trochanter. Not every business allows you to do that. Some like massage ME, you can only do like the what do you call it, the boy underwear cut or whatever you call the brief. I don't know, you can only drape to here, but I don't know, like this is a huge area for pregnant women to have work done that really need it. That's like key. So I can maybe, I don't know which way, maybe that way, we'll see, whatever you can see. So if you have a big honking blanket like me, you're gonna move it up all the way to out of the way. So the easy one and the hard one. So which one do we want to do first? I guess the easy one. If I'm just, whatever. I guess you need to read your client and find out what they put on the intake form and feel how comfortable they are. I don't think anything's going to slip anywhere doing it this way, but basically you just take the bottom of the sheet, divide it in half, and follow it up to the area that you want to expose, and while making sure at the same time the bottom leg is not being exposed and there's nothing in front being exposed. You're just going to get that above the greater trochanter and maybe up to the gluteus medius, and then while you're holding it there, you're going to tuck it under the hamstring here and around the quad to the adductors there. And so now I can tuck it under again till it's nice and tight. You might not even have to do that. If it's staying in place, just making sure that everything is covered, and now you can work on this whole area here. So that's an easy drape. You just kind of up, around, tuck. A more secure drape would be a little bit different. Instead of the very bottom of the sheet, you're going to go to the front of the sheet. You're going to take this corner, and between that and where the baby is, we're going to kind of go in the middle, and we just want enough that we can drape. So yeah, not quite to the knee, maybe right below the knee of the person. And you start moving that part up. So this is the front of the sheet, kind of a quarter of the way up the sheet. We take that part up to the greater trochanter. And then we could take this end and come behind the knee. So I just tuck it under the knee and come out the other end. And then I make sure that there's enough sheet covering as I go and that the baby's covered here. And if the pillow's on the underneath, it makes it a little harder than if it's on the outside, but you gotta practice doing it both ways. So if you can do it with it under, you can do it the other way. Then you just kind of shimmy it back and forth, and you don't have to worry about being light or anything. What you don't want to do is like compress the inner thigh because of blood clots in there, but you do want to do it aggressive enough that they can feel where the sheet is and what's going on. And once we get it into place, kind of back and forth, making sure at the same time that's covered, this covered, that's covered, this covered, as you're working your way up and shimmy, shimmy, shimmy. Then you can take this leftover tail, tuck it under the rest, and tuck it under. That gives them a little bit more feeling of like they're wearing underwear and secure. I learned that way for if you're going to be mobilizing their leg and moving it around and stuff, that it's placed. But basically I'll do all the tissue work here, and then when I'm done, if I want to mobilize, I'll just pull the sheet down and do it with the sheet over them anyway, so I don't have to worry about anything being exposed. So when I'm done, I'm just gonna lift the leg a little bit and then pull the tail out, and then it's time to switch sides. Okay, so now we're gonna switch sides. I will let her know that we're gonna switch sides now, and I'm gonna remove all the pillows in front, and then she'll turn at when I tell her. So you can grab all three by grabbing the edges of the pillowcases if that's easier for you to grab than the thick ends, but I'll just do it on the thick end. It's usually easier to pull it out because they can guard their knee as I pull it out. So I'm going to hold the sheet and pull the pillows out. And then if you have a chair, you can set it on the chair or you can hold them, whatever you want to do. You get better at it as you go. I usually take the sheet here and I hold it with my hip before I have her hand me the pillow that's underneath. So I'll have her just either hold the sheet like she's doing and I'll pull the pillow. Right? So she's secured. And then as I hold this with my hip, I'm going to grab the sheet here. You can turn either way, but turn it onto your other side and then scoot back so your back is more towards you. And what happens then, if you're leaning against this, the short end is now on this side and the long end of the sheet is on that side naturally because it went with her body as she turned. And we just saved it here. So if you have normal cotton sheets, that works easier than if you have those micro fleece sheets or flannel sheets. It's hard because it'll stick to the table and it's really hard for them to turn and the sheets stick in trying to get them in and out. So if you have slipperier sheets, that's a little bit better. So now that she's there, I could hand her the pillow to go under, or I can just hand it over the top. And that's what most people like. And it's easier for draping down here if the pillow's on the outside than on the inside. I might scoot it up a little if they're short and I can't get these in there. And so you could use a body pillow or something like that too if they're putting it between their knees. But again, it's kind of better if you can have one leg down and one leg up. So I'll have you straighten both legs to start. I have a little room. I'm just gonna put all three on at the same time. Once I get those into place, then I can have her, I'll compress it with my arms as she brings her leg up. And then one thing is if the knee's right on the edge, it might fall down. So what you might need to do is support the leg and adjust the pillows up a little bit so that there's a little bit of room above the knee so it doesn't compress down so far, and then it keeps the knee and the hip at the same height. You also want to make sure that the ankle's not falling off and that it's here. I can tip the pillows that way if I need to, or this way, whatever, Most of the time you need to kind of go on a diagonal rather than straight to get both the ankle and knee on the table. And then we're good to go again.
Okay, so that was the draping and positioning, and now I wanted to talk a little bit about the pressure that you should be using when working on massage with a woman who is pregnant. And basically, deep tissue is fine in safe areas as long as it feels good to mom. There's no problem doing deep tissue. What we want to make sure is that we're not doing deep tissue on any area we normally would not be doing deep tissue in, like on vascularities, obviously not on the baby, and just common sense, not on lymph nodes. But also we want to make sure that it's pleasurable to mom. There was a quote by the Samuels in the New Well Pregnancy book that said, "Hormone signals diffuse into the fetal circulation through the placenta, and the fetus is similarly negatively impacted." So basically that means what mom is feeling, so is the baby. If mom is feeling stressed or pain, then those hormones do not get filtered through the placenta. It goes straight to baby. So we want all the dopamine and serotonin, all the feel-good hormones to be going to the baby, not the bad ones. So again, we're not going to do deep pressure on vascularities. Edema is another one. Some pregnant women have some natural swelling in their feet, so we want to make sure we don't do any deep tissue or pressure on the edema or any induction points, which we'll talk about in the labor section. Nothing on the abdomen or lymph nodes. So we want to look out for those Mississippi River looking veins, those varicose veins, any kind of veins that stick out or discolored. And those capillaries are more fragile. So we want to stay broad. Circulation is fine. Nice Swedish relaxing stuff, but no pointed or deep pressure, no muscle stripping, no forearms, no elbows and things on that. So sticking with the Swedish, draining in the legs, as long as there's no contraindications. All right, so 2 more things. When we are massaging with a pregnant woman, she's going to have the relaxin hormone, and that makes her kind of loosey-goosey. So if we were working on her back, like the top picture here, she would just kind of collapse forward if we didn't have some sort of counter pressure there to support her. So whether we're working on the pelvic girdle or the shoulder girdle, we want to have that opposite hand supporting and placed in that way. And then on the bottom photo, if we're asking our pregnant woman to do any kind of stretching, we want to advise her to stretch into her heel and not stretch pointing her toe. So sometimes when you stretch when you're pregnant and you stretch into your toes, you'll get a Charlie horse. So just wanted to bring that up. And of course, before doing any kind of body work, probably not a bad idea here, especially when working with pregnant women, we want to take a breath, let go of any personal stress or negative thoughts, and be conscious and present, or mindfulness, right? It's also a time we can do the mother-baby connection. One thing I like to do is place one hand on the mother's head and one on her baby, and maybe ask a question, you know, is it a boy or a girl? And just draw a little attention to the mother-baby connection. And then we want to do some mobilization, some nice deep breaths, and allowing, you know, to assess what kind of restrictions are in the soft tissue for one, but 2, it just helps the person on the table. It will help her to get out of her head and breathe, and so she can become mindful as well and feel her bones and her muscles and now be present on the table and ready to receive body work. The way in which we move as massage therapists will be a little bit different as well, because now we're not working, you know, looking at the body the same way. So the way we apply pressure in deep tissue is going to be a little bit different. We're going to be working across the table, not looking sideways. We're going to use our body mechanics and twist like Chubby Checker here, doing the twist. So our elbow can be supported in our hip, and the hip can do the pressure instead of our shoulders, and avoiding us to get neck and shoulder pain as therapists. So we want to work smarter instead of harder. So we're going to go ahead into the prenatal techniques, and you'll have some examples of this.